Welcome back to Viewpoint, filmed this afternoon on the rooftop of number 6 Convent Place with the Director of Public Health, Dr Sohail Bhatti, and we'll move on to questions about testing now.
The picture around testing is that it's a very dynamic situation. Lots of people think they can make a lot of money, and so there's a lot of research coming out, and there's even a saliva test that might be able to be found. But what our duty really is to find whether it is going to add to what our armoury is, not take it away from it. And of course, one of the balances against that is how quickly you get the test result. And currently, our technology gives a result potentially in less than 4 hours. And we're innovative, and we know that the UK is looking at adopting the technology that we have as part of its testing strategy.
Usually you are returning results same day or next morning?
So that's our quoted turnaround, is within the 12 hours. As you can imagine, or maybe you don't, but we have to transport the swabs to the lab. So we have to wait for the swabs to be done, then collected, then we have to transport them. Now, you may ask, well, why can't we do that instantly? Well, if I had an army of people that could take it, then we would have, but everyone understands waiting for a bus. It's the same thing. You've got a finite number of people, you have to take it. So the swabs go through, and usually, and we've tried this out, we've tried to get people tested earlier. People just don't want to be tested as early as that. They want to do it 9 o'clock, 10 o'clock, 11 o'clock. So that means the earliest we can really start to test is about 1 o'clock. 4 or 5 hours later, we then get a flurry of a lot of tests coming through, and we have to then report them, both the negatives and the positives. The positives have a consequence, which is we have to tell people they are positive and who had they been in close contact with. And we often, and I know my contact tracing team, have results coming in 9 o'clock sometimes, and if it's a school, you can't just walk away. They have occasionally used people's good offices. I'm positive, can you draw up a list please of all the people that meet these criteria, and they'll do some of that work for you. But it means that the next day you come in, you're not unnecessarily antagonizing and annoying people who are saying, well, you should have told me yesterday. So we are doing the best we can with the way that the system currently works, but the system could be improved.
Okay, you mentioned saliva tests at the beginning of that answer. Are you trialling them at the moment with known positives?
Yes, so there's a validation process. What we do is we test them against known negatives and known positives, and we see what the results are comparing saliva with a nasopharyngeal swab, and we have to do that repeatedly and see in which conditions. So I know, for example, the saliva is stable for 12 up to 24 hours. But it tends to be not as good if you freeze or cool it down. We're still trying to work out what the optimal process is. Validation of saliva is advanced. We are looking at then having to work out how do we collect the saliva, what would be acceptable to people. I'm not talking about phlegm, by the way, which tends to put people off. I'm talking about the watery bit, the saliva that comes out when you're thinking of what to eat. On
the tongue, on the cheek?
On your tongues and cheeks. The watery stuff is the saliva. We need to collect around 4 mils, a tablespoonful, to give us a good sample. If we get too little, then the result becomes a bit iffy. So I need enough to be able to test it. And then we have to trial out, are our instructions appropriate? Do people understand what's going on? What about people who only understand Arabic or only speak Spanish? So we've got to trial out all those processes, and then we have to think about, well, it's not swabbing, but how do we distribute them? How do we collect them? How do we tell people it's their turn? We've got to work that out. And at the same time, I've got the lab team working away at saying we can use saliva in these circumstances, and that also has an impact on the instructions we give people. So it's not a simple process. It's quite complicated, and at the same time we will continue to run swabbing for people who are about to go into hospital or who may have symptoms.
But you're hoping to introduce a saliva test in schools soon? Yes,
so my target date on this is towards I hope to have it before the end of October. But there are practical difficulties. I can't go into a shop, a sort of testing shop, and say, give me 10,000 of the packs. We almost have to make those packs now, and if our aim is to do 1,000 a day, then that's a whole manufacturing facility to do 7,000 of these. And that's not just the only thing. We have to unequivocally label each sample as belonging to an individual. And I think we need to find the best way to do that. There's no point in the samples being thrown into a big bag and then we don't know who it belongs to.
Obviously you've worked out a workflow that is good enough in your eyes for the other tests that are being used to determine, the swab tests that have been used to determine if somebody's positive. How are our stocks of swabs and reagents at the moment?
So the beauty of it is that we've got tens of thousands of swabs, we've got ample supplies of them, and we've got a good supply of reagent, given that we've ramped up the fact that we're going to do 1,000 a day. So we've got a good supply line of the reagent coming in, we've got a good supply line of swabs. We're currently in the process of buying, I think, 100,000 of the pots for saliva, because I want to swab, I want to test actually, as majority of Gibraltar, on a monthly basis. That will protect us.
Okay, the long drawn out Brexit process really resulted in increasingly polarized camps. Do you think that something similar is happening with the pandemic, where people are increasingly becoming entrenched in their view, whichever way it is, as to what steps are sensible and which ones are over the top?
Yeah, anti-establishment views are quite clearly out there. Anti-vaxxer views are quite out there. People naturally fear authority they don't understand. There's an anti-scientific endeavour. People do tend to forget that the quality of life that we have, the fact that we can make a cup of coffee or cook meals or wash our clothes, is down to electricity and science. So yeah, you know, if you really do want to have those perspectives, there are places where you don't have all those joys, you know, the places that are very rough places to live. So with the price of all that technology comes, it's a package. You can't pick or choose. I was accosted in the main street the other day where someone said, you're never going to get me to be vaccinated. It's against my religion. It's not in the Bible, or it says in the Bible you shouldn't be vaccinated. Well, of course there are 100 views on what is and isn't there.
I give a lot of thought before I take a vaccine personally.
Why is that?
I'd like to know the facts before I would.
I most certainly would. As long as it had been tested and proven, I would take it, yes.
I'll have to think about it seriously because of the after effect of the vaccine, you know. Mm-hmm. At the moment, the prognostic is not very good.
I would definitely take it, yeah, I think so.
Please, China.
So yes, there are people who are finding succour and support in their own echo chambers, but I keep people mindful of the fact that the people that spread these things in social media don't always wish us well, and there's now quite a lot of evidence, Cambridge Analytica and all the stuff that was related to Brexit as well, that some of our strength, which is democracy and debate, has been subverted by people who wish to divert us from sensible discussion into using fear. And remember, I did use a bit of fear at the beginning, using fear as a way of misinforming and driving people into an environment almost of paranoia. I'm happy and I've always been willing to have discussions, but at the end of the day it becomes almost like a religion, and as most people of a faith understand, you can't persuade people to be in a different religion. That's not the way it works.
You've also said a member of your team was verbally abused and I believe spat at by somebody who had very who thought that the way that the public health campaigns were being run were infringing on his or her freedoms.
Well, I mean, it's a bit strange, isn't it? You shoot the messenger, but you don't listen to the message. The message is we're all at risk from COVID. We don't actually know what the long-term effects of COVID are going to be. COVID-19 may have very detrimental effect. We just don't know. So what we're trying to do is protect our population. We're not trying to subvert the population. We're not trying to subjugate it. Our job is to protect. So when someone spits at someone who's working 100 hours a week, day in, day out, it's disappointing. And you know, the bottom line is You don't really need to do that. Yes, of course, there's a pressure cooker, and of course, there's a lot of harm around mental health. And I've gone on TV and said, be kind to yourself, be kind to other people around you, forgive yourself, because we all are human and we're in really, really extraordinary times. So let's not spit. Let's be helpful. Let's be friendly. Love is much, much more powerful than hate.
You mentioned Chatham earlier. Did the public perception of large social gatherings and also perceived inconsistencies, no more than 20 at a barbecue, but as many as you want at the beach, have those things, difficult as they are, have they undermined people's trust in public health messaging?
So the fourth C of the WHO, which I didn't talk about and isn't there, is my C, is complexity. So in July, when we had no COVID that we could record, even though we were doing 300, 400 samples a day, it was pretty reasonable to assume there was no virus. So as people are doing in New Zealand and in other countries in the Far East, they are mixing, and we did mix, and there was no consequence. But the virus is not the same now. This changes dramatically almost day by day. And in the current environment, we've got to have more social distancing. So I do struggle with people not realizing we're on a journey. And that journey includes knowledge, it includes mistakes, it includes the way the virus changes, though it's not changed that much, but our perception of it. So Chatham did represent a challenge. That's where some of the on-the-spot fine scenarios we discussed at the civil contingencies meeting was.
They were issued?
I think they have been issued, yes. The RGP would tell you, but we certainly had a meeting yesterday about trying to instill that sense that this is our patriotic duty. As people in Gibraltar, we owe it to everybody else to realise that our freedom comes at someone else's loss, if you like, and at the end of the day, we all know what that means. We get in a car, some of us get in a car and follow the highway code. Most of us realise the fastest way to go from A to B is to go straight to A to B, but most of us curtail, we follow roundabouts, we follow lights, because we understand it's actually safer for all of us if we follow rules. And that's what we're trying to do. We're trying to work out rules, and the rules change according to circumstances. So the crowd that's in Chatham changes, the age range changes, the venues and what's happening changes, and I'm constantly trying to update protocols and try to have dialogues, but it's imperfect. There isn't a huge amount I can do until after the event, and then we have to instill, and I'd far rather educate than to do some kind of enforcement with fines and the legal process. But we are together, it's together Gibraltar at the end of the day. I'm trying to protect people, I'm not trying to restrict people. If I can, I've done everything I can to avoid restricting people, and there may be a consequence of that, and it may mean people are in hospital. It may even be, God forbid, someone dies. Statistically, the likelihood of us not having a death is very, very low, but we're not superhuman, so we have the same genes as everyone else, and it's quite likely at some stage someone will pass on, and I don't want that to happen. I've done my damnedest for the last 9 months to avoid it, but probabilities are unforgiving.
In short, do you still think that we're all going to get COVID-19, or most of us?
From a biological point of view, we are prey to the predator, which is the virus. And the virus doesn't really care what age we are, it doesn't care what our job is, it just attacks us. So from a biological point of view, a susceptible population of 100%, now it might be 90%, means that the virus spreads, it will still spread vigorously. I know there have been calculations, people working out that if you have a percentage, then the chances of you meeting someone else that's susceptible is reduced, and therefore you would decrease the rate of spread. But from a biological point of view, 100% of the population susceptible, no resistance, the virus will spread. Yes, we've got a little bit more evidence to suggest that children who get colds 4 or 5 times a year may have met a familial coronavirus that might render some degree of resistance, and that might be why they don't get as much in the way of illness and consequences as adults do, but that's speculative. So yes, from a biological point of view, we will get it. Unless politicians and our behaviours intervene. So that's the other thing to keep in mind, that our behaviours have changed. So we're not all going to get it because our behaviours have changed. And the Contact Tracing Bureau is there to make sure 100% don't get it. So if we did nothing else, 100% would get it, but we're not there.
Go out less. We've been going to restaurants less, eating out less. Holidays, forget about it. We haven't been anywhere since it started in February. So
just keep my distance and not socialise as we used to.
I don't think we'd have to have a lockdown again, and as an older person it wasn't too bad for me to be at home, but I feel sorry for young people if we have a lockdown.
I think it's coming. It's another one coming because it's getting worse.
Well, I had to come back to Gibraltar. I was away, traveling in India, so I had to come back. On a daily level, just keeping to myself.
People think that it could be a conspiracy and this and the other, but I believe that it's something that you know, that it's dangerous, and that's why you know the world is reacting as it is.
Some people are suffering from depressions. It's having quite a negative effect in the long term.
I want to give back my normal life.
The fact that there is not really at the moment the light at the end of the tunnel.
I feel quite stressed and concerned, obviously, but I don't know, I somehow feel optimistic that it will end by summer of 2021.
Always with me, and every time I go into any place I wear it. Changed my life, yes, I don't go out as much as I used to, and it's more stay at home than anything else except for the essential bits and pieces.
I'm feeling scared. I'm very scared, yeah.
Well, it's going to be here with us for a very long time. It's not going to disappear overnight. So we have to adapt. It's a different world, it's going to be a different world as from now.
GBC understands the Gibraltar Medical Registration Board, or perhaps another official GHA or government body, has suspended a practitioner for alleged infractions of COVID-19, a health practitioner. Could you confirm this and give any details?
Well, I'm limited in what I can say. I have to protect the interests of that registrant, right? But you know, clearly there was a presentation made, and there were some serious issues about that registrant not following contact tracing advice, and there was other issues related around that, and therefore it was the view of the board that patients had been put at risk, and therefore it was something that we took seriously, and we've had to suspend that individual whilst there's further investigations that carried on. I don't think it's fair to say any more than that, because of course everyone is potentially innocent until they're proven guilty.
But the first of its kind?
Certainly in my memory, yes.
Okay. Do you think Gibraltar can avoid another lockdown?
The answer to that is yes, we can. We're doing everything we possibly can to avoid it, but we need people to help us. There's no people sitting in number 6 who can suddenly drive it away through some sort of magic wand and say, off you go. This requires the people of Gibraltar not to want lockdown, and if they don't want lockdown, they know clearly the things they have to do.
Okay, and can we avoid lockdown with the tools currently in place, or do you foresee needing further restrictions?
It's a matter of debate to some extent. If our contact tracing functionality declines, then we may need to think about what other ways we've got, as other places are looking at various restrictions. But my instinct's not to restrict if I can. But at some point we're going to have to take a risk and say, actually, do you know what? The risk becomes unbearable, and the problem for us with this virus is the results we have are 2 weeks behind where the virus is. So if, for example, we decide now the hospital's full of people, it's too late at that point because we should have acted 2 weeks before. The question we should always ask ourselves from our future selves is, what would I have told myself 2 weeks ago that I should have done? Sure. And some of them are difficult. It's like anything, prevention's always difficult. It's even more difficult politically to seem to be acting when the threat is not imminent, because that's the nature of politics. And I've got to say our politicians have been very mature at handling that.
I don't think this is, strictly speaking, your responsibility, but it is a tool that public health is drawing on, or purportedly is. The Beat COVID app, is that working?
We've tried to get it to work on a number of occasions. I think we've used it about 3 dozen times. Response hasn't been as we might have anticipated, I think, but that's not unusual. I think all over the world people are having trouble with some of the technology. I think the newer phones require less energy, the older phones, so it's a whole ecosystem that you have to provide for, and I can see the technical difficulties in being able to do that. In terms of aspiration, absolutely the right thing. In terms of the way that we found it useful so far, it's not been as useful as we would have hoped when we did it.
If we get the product in time, that's my worry. But that's specific to Apple because of COVID. Everything was a bit delayed. So, are we going to get how early, how soon are we going to get their new product release? That's our worry.
Not looking good. Not looking good at all.
Tell us why.
Is just no tourism, and obviously we deal a lot in tourism.
It's stupidly expensive to get hold of any masks during the COVID lockdown, but now that's it's a lot more accessible and the prices have gone down. So it all depends on whether you have old or new stock, I guess.
We've made a couple of redundancies, basically of some of the staff that we'd employed in the last year, but we're trying to just keep as many people employed as possible. And like I said, we're just hoping for better times to come.
Two final questions to wrap up, Dr. Bhatti. What advice, firstly, would you give to people who may be thinking about going away at the school midterm break?
It worries me that particularly because we know that's exactly what happened in February, March. People went away, they came back with the infection, and it was set into our population. So I think one of the things I'd ask you to do is think wisely about where you're going. Always think that just because you're on holiday, you're not socially distancing, then why not? Because you might bring the infection back into the community. And the other thing is, could you perhaps tell us, maybe we'll need to think of a number maybe that people can dial in to tell us of their plans, and we would certainly like to do a bit of follow-up when people do come back, a bit of aftercare if you like, including possibly a test. We haven't thought that through yet entirely, but if we know what your plans are and when you're coming back, we can put in protections so that you don't spread it to others, because you won't necessarily know that you're carrying it if you're asymptomatic.
And finally, you referenced very long working weeks for you and your staff. Are you managing to take a break from time to time, and what do you do to unwind?
I'm actually away to the Donyanya National Park not long after this interview, which is why I wasn't available this evening. I don't have enough time to unwind, I think, the truth of the matter is, and that's part of, we're in a war, you can't, and everyone knows you can't just sort of walk away from the battlefield and say, I'm going to take a break now. But it does have a detrimental effect on a lot of people's well-being, which is why I emphasise the importance of being kind to each other and understanding that people make mistakes, etc. So I have very little time for anything else at the moment. And I did say to people, it's a marathon, not a sprint. But we're in the middle now, 9 months down the line, with it possibly lasting another 6 to 9 months. It's not a great prospect. So we need to, hence, for example, I've spoken to the GFA about how football can restart. I've tried to encourage sports to restart as much as possible, which is why people are doing it. I've even got a meeting with the Girl Guides about how that might work. So I'm trying to reopen society in a managed kind of way. Personally, that's where I get my joy from. And if I can say, This is what I trained for 30 years, this kind of pandemic. So in that sense, I get a great deal of job satisfaction to be able to say, this is what we did together and this is what we defeated this virus. But what I'm really fearful of is we don't go down the Israel scenario, and I'd ask everyone to look up what happened in Israel. I think it's also happening in the Czech Republic, that we succeeded and then we let a guard down and now they are in lockdown again.
Well, we wish you every success in the coming weeks and months. Dr Sohail Bhatti, Director of Public Health, thanks a lot for joining us on Viewpoint. The Director of Public Health, Dr Sohail Bhatti, speaking to GBC's Viewpoint this afternoon. It's beautiful autumn afternoon on the rooftop terrace of number 6 Convent Place, confirming, among other things, that one registrant of the Gibraltar Medical Registration Board has been suspended for suspected breaches of COVID-19 regulations, and expressing the hope that despite the climb in cases in the past few days, that Gibraltar may be able to avoid a second lockdown in the coming weeks and months, but only, he says, if everyone works together and does their bit. What do you think? Join the conversation online. From the whole team, thanks a lot for watching Viewpoint. We'll be back at the same time next week. Good night.